My name is Kathleen King and I'm a medical scientist. I also am a volunteer chair of the Endometriosis Association of Ireland. I've been an endometriosis advocate for 22 years now, which is actually half of my life this year. And it's been a big realisation that endometriosis and chronic pain has just been a huge part of my life. Yeah, I started to experience very painful symptoms from my very first period, and I also experienced very, very heavy menstrual bleeding. And at the time, that was when I was 12, I didn't really know that that was unusual. But as the year or two went on, I started to realise that nobody else around me was experiencing that level of pain or that level of bleeding. So I self-diagnosed at the age of 14. I had a medical textbook in the house, which was my Bible, and I went along to my GP and tried to convince multiple GPs that there was something wrong. And unfortunately, 9 GPs later, and nobody wanted to believe me. I was too young. I was looking for excuses to get out of school or college. When I asked to be put on the contraceptive pill, which was again a recommended treatment for symptoms at the time, it was put down as an excuse that I was looking for contraception without my parents' knowledge. So it was very, very difficult to get a diagnosis, especially at such a young age. And I think the lack of awareness and the lack of discussion around menstruation and positive menstrual education at the time in Ireland really sort of added to that sort of stigma, and also that lack of awareness of a condition like endometriosis. It was just so difficult, because the attitude was, even if it is endometriosis, there's nothing we can do for you. You're going to go and have a baby at some stage and then have a hysterectomy and have your ovaries removed, because there's not much else we can do for you. There's a huge bias, I think, towards women in general. In particular myself, I felt that, you were made feel that you were catastrophizing. That literally a woman's pain is not believed. You try and describe the pain of endometriosis, and to me, there's no pain that comes even near it. In my 22 years, I've spoken to women who've given birth to multiple children, and labour is a doddle to them compared to their endometriosis pain. So I often find, and listen to women over the years too, that we're just not believed. It's this impression that, no matter what we say about our pain or bleeding or symptoms, that it can't possibly be that bad, or that there's a sort of hidden thing to it as well, maybe that it's just we're looking for something else, but this is our way for attention. And I've seen this, my own situation as well as other women. When you report symptoms like bowel issues, bowel incontinence, pain with urination, passing blood, maybe with bowel movements, painful sex, don't even mention that to a GP, because they'll just hide in the chair. Again, it's suck it up and get on with it. That's a very crude way of sort of putting it, but that's how you're left coming out of your appointments, and it's devastating. It really is. I know some people would say, look, try a female GP or try a male GP. A male GP will give you the benefit of the doubt, or a female GP would be more understanding. But I think the bias definitely comes from the lack of awareness and education around endometriosis and the complex symptoms. So it's an education thing. It's not necessarily somebody deliberately setting out to be quite mean about it, but I think the understanding needs to come. Well, my diagnosis came about when I came to train in Donegal as part of my degree, and I pleaded with the GP here to send me for a referral to a gynaecologist, and she wasn't keen at all. So she wrote the referral letter, and she put on the end of it that she was happy that there was nothing wrong with me, but she was entertaining my request. So I was happy enough with that. I had a letter. I also had money, because we got paid for our student training year as medical scientists. So I was delighted. I headed into Northern Ireland to see a gynaecologist, and I had my symptom diary, which was this thick. And I was so excited going in, because I'd heard great things about this man. And I was in the chair probably about 2-3 minutes and just given the symptoms straight away. He was like, yeah, you have endometriosis. We'll confirm it with surgery in 2 weeks' time. And it's amazing that when the surgery did go ahead in Altnageld, and then a couple of weeks later, he stuck his head around the curtain and it was 2 thumbs up after the surgery. He was like, yeah, there's loads of it in there. You know, so the validation. But even my own GP, when I came back, she was like, well, I'd never have expected it would be there, you know, so it was difficult. But I'm very fortunate now. I have an absolutely fantastic GP and team of GPs actually, who are brilliant. We work very, very closely as a team. I like to see myself as head of the healthcare team. You know, like all patients, I advise them to sort of say, look, set yourself up as the head of your team. You're the one with the knowledge. These people will work for you. We work very closely together, and I've been able to really balance my treatment over the last number of years, which has been great. So you think in 32 years since I started my periods and since the onset of my symptoms, that things would have changed dramatically. But we don't know a huge amount more about endometriosis. We don't know what causes it. We still don't know what is a definitive gold standard treatment. We know that excision is one of the best treatments that we have. Unfortunately, it's not widely available. We still don't know exactly how some women do develop it, some women don't. There are family links that we know. There's stronger family links. If you have a first degree relative, you've got higher risk of being diagnosed, but there's a lot of things we don't know. And I think we are seeing now more than, I suppose, maybe 20-30 years ago, is that it is quite a systemic disease. It's not just the lesions that are in the pelvis or on the bowel or bladder or the lungs, the brain. You know, it does have a systemic effect. So women would report quite a lot of fatigue, a lot of tiredness, maybe joint pains, a lot of symptoms like that as well, to general feeling of unwell. Well, for me, I think that the very first impact that it had was, you know, that level of pain and bleeding at such a young age. It just nearly stopped everything. You know, from somebody who is really big into gymnastics at school, that had to stop. You couldn't do that when you're bleeding and rolling around the floor in pain. But it also had a huge impact on my education. So instead of being down the path maybe towards, like, you know, a career in surgery, you know, I had to rein in my expectations realistically. Like, I was going to be lucky if I was going to make it to college, because the level of concentration and the level of sort of overcoming that's required when you have that much chronic pain, it's very, very difficult to study. But I was very fortunate. I did get to college, which was good. I done biomedical science in Galway, and you know, I work in a hospital lab, and I love it. I do enjoy that. But yeah, endometriosis has huge impacts. You sort of think of the times that you miss out on. So you do miss nights out, you miss maybe friends' weddings, you may miss family occasions, a lot of social things like that as well. And people do start to look at you after a while and think that you can't really be that sick all the time. But chronic pain does take its toll. And it takes its toll in a lot of relationships. You know, like, from personal and also from experience, like of the wider community as well, you see that, you know, friends drop off, you know, relationships, personal relationships, you know, your partner can become quite strained, and also with family as well too, because people find it very hard to understand that you can be in that level of pain all the time. I suppose for me, with my diagnosis back in '97, the first thing I had to do was I had to turn the anger of the 9-year delay into something positive. So I got in contact with the UK and the Irish organisations. I've trained in the UK on their helpline, and I volunteered with them for a number of years, and then ended up, you know, taking over as chairperson of the Irish organisation a number of years back as well too. So from that point of view, that's really, you know, the advocacy for me has been one way of keeping my focus positive and making sure that I can get myself through this, because there's always somebody else relying on me in terms of making sure that they have accurate information, or if they need additional information for an appointment, or they're going through a surgery, or even just to share an experience. So that's always been very, very important to me, and it's been a huge driver for me to keep myself sane and to keep myself well. That's not saying there's not been incredibly dark times at 3 a.m. when the painkillers don't work and you're staring down, the opioid barrel, as I call it, when you've taken all of the oxycodone that you can take in 24 hours and it wasn't going anywhere. So for me, research has been a huge part of this. Since '98, since we were able to get the internet, when I was at college, it was brilliant. I was able to research a lot more about endometriosis, find the best treatments. And I was very fortunate 2.5 years ago to travel for surgery to Atlanta with a well-renowned endometriosis surgeon. And that has changed my life. I have a 90% reduction in my pain. I still have chronic pain. I will have chronic pain because I had 7 previous surgeries to that, all of which caused their own damage. And on top of that, then there was a lot of endometriosis that had never been touched, and that has caused permanent nerve damage that will never, go away. But the reduction in pain has been so positive that, life like this now doesn't bear any resemblance, to life before my last surgery. Well, I think the first thing I would say to anybody who suspects they have endometriosis, or who, is maybe not receiving the treatment that they feel is beneficial to them, get a second and a third and a fourth opinion, and come to an organisation like the Endometriosis Association of Ireland, or speak to another advocate out there who can help you with some of the scientific information that you can take to your doctor and maybe discuss better treatment plans. Endometriosis is certainly not a disease that you can throw yourself, at the feet of a medical team and say, cure me, because there is no cure. We just have to learn to manage this. So we have to be good self-managers. And yeah, there are days when you can't self-manage and you can't advocate anymore and you can't even lift your head. And that's when you have to have your team prepped around you. You have to have your GP, you have to have your pain specialist, your gynecologist, and then your friends, family, partner, your cat or dog, have them all lined up. They are part of your survival team. And like one of the things I think I came across maybe back in 2002, and I'm delighted now the HSE have brought it into Ireland, is the Chronic Disease Self-Management Programme designed by Kate Lorig in Stanford. And it's an excellent programme, and it teaches you that even if your achievement in the day is only a walk around the outside of your house, it's better than nothing. And for me, self-management has been a huge, huge thing in this. And I encourage anybody to sort of do that type of course, empower themselves. And it gives you the tools then to cope with the days that are really, really bad, or the nights where you literally can't face to go on anymore.